Hello everyone, my name is Dr. Joel Rosen, and I'm really excited to be presenting this video today because it means that I have given... All right. Hello everyone, my name is Dr. Joel Rosen, and I am really excited to be producing this video for you today because I'm going to be providing you with a wealth of information for people that are suffering with debilitating neck pain, middle back pain, lower back pain, structural pain in their body, typical pain that you'd go to see a chiropractor for or physical therapy for, and yet you're still suffering. And so what I do in my office is I approach a neck pain or a back pain a little bit differently, and that's why I wanted to produce this video for you today. Again, my name is Dr. Joel Rosen. I am a practicing chiropractic physician right here in Boca Raton, Florida. I've been practicing for the past 14 and a half years, so almost 15 years. And I am also a certified functional medicine practitioner, which basically means I look at the body from a physiological point of view, from a biochemical point of view, and try to put them together as to why this person may be suffering. And we try to approach it from a naturalistic, holistic type of approach, so that we're not just trying to help the back per se, we're trying to get you in shape. And that's what this video is about, and hopefully you'll find it very, very informative, and then hopefully I'll end up seeing you somewhere down the road and give you some life-changing care. The title of this video is called Introduction to Structural Protocol, a Neurological Protocol, and a Metabolic Protocol for the treatment of chronic neck and chronic back pain. So I have a mouthful there, but basically there's a three-pronged approach. And the three prongs is if you have a debilitating neck pain or debilitating lower back pain, then we need to focus on three hidden factors that are causing your problem. And with most other providers, they're focusing only on one of those things and maybe two, but not three. So we put all three approaches together, and that's where we find the best results. The first one is the structural approach, and that really makes sense to you. You got a structural problem. Your spine is a bunch of bones that sit on top of each other, and those can cause wear and tear and degeneration and rubbing and grinding and stimulation of pain. So typically it's going to be a structural approach. But the other approaches, the metabolic approach and the neurological approach, are what you really need to understand so that you can get the relief you're looking for. So let's talk a little bit about myself. Again, I've been practicing for 15 years. I am a board-certified chiropractic physician, as well as a eligible chiropractic nutritionist, which means I've earned enough hours to call myself a diplomate of nutrition. I just have to sit before the board to take that test. And so what I do is I approach all my chronic care cases, which typically a person that has neck and back pain, even though it may have started a week or 2 weeks ago, it's typically one of those things that's been suffering for many, many years, and they can go back, to 15, 20 years ago where it first started. I also approach it from a functional neurology point of view. I've done some extra training in the American Functional Neurology Institute, which you'll find very interesting as I go forward. And lastly, like I said, I'm a certified functional medicine practitioner. So let's talk about some of the common symptoms that you deal with. Back pain, you don't need me to remind you, can be debilitating. You can't get out of bed without feeling pain. Sitting on the toilet first thing in the morning and you can't get up or down. Trying to put your shoes and socks on is a task every morning. Trying to reach above your head or turn to look around you is a problem. Maybe getting into and out of the car is very, very problematic. Also, just wanting to get out and be social with your friends, going out for dinner, or carrying a grandchild, or getting on the golf course, or traveling. All of these things are being affected, and we call that an impact of your activities of daily living. So you can't do the things that you want to do normally. You can't go to the grocery store and buy water and put it into the trunk, or you just are tired and you're not sleeping very well. So these are some of the things that we see associated with neck and back pain. Also, we see some tingling, numbness, radiating pain that goes down the arms or goes down the legs. We also have burning pain. We have weakness, so we may drop things, or you may not be able to hold your toe up. And you also may have some atrophy where we look at the size or the circumference of the muscle and they've gotten smaller. That's when we really know there's some neurological involvement. Also stiffness, so we don't have a lot of flexibility or mobility. We get tired, or you get tired very, very quickly. And not to mention how aggravating it is. It changes your mood state. You're not a happy camper, so to speak. And what I tell patients is think about how much this is affecting or impacting your loved ones by you not being able to do what you want to be able to do and being in pain all the time. When I do a workshop in my office, I try to explain to patients how bad is their life on a 0 to 10. And they say it's a 10 or it's a 9, but they're not motivated. But they are motivated when they think about how much this is impacting the loved one and how much frustration they're dealing with not seeing you being at your fullest. So think about that and make that an important goal for you to want to get better. Losing your ability to perform your activities of daily living. And some of the more important things that I want to talk to you that's going to ring true for you is the fact that you're not suffering with only a back or neck problem or numbness and tingling or your inability to do your activities of daily living. You are suffering with a bunch of other problems that you may not even realize are related to your back problem or neck problem, and they are. So some of those things are loss of balance. You'll see that when I talk about how your neurological protocol impacts your spine or how your spine impacts your brain, the cerebellum, which is responsible for balance and proprioception, directly innervates or is responsible for spinal structure. If you have a spinal structure problem, then that's going to affect your cerebellum, which is responsible for balance and coordination. So you may find that you're not as steady on your feet, and the real concern for that is the most common cause for accidental deaths are falls. And so if you're not feeling your feet and you're not stable, you probably know of someone that broke a hip or someone that is in the hospital because they fell or God forbid worse. So that's a very common occurrence. Peripheral neuropathy, not feeling your toes, not feeling your hands, having numbing tingling, and just having to look down at your feet when you walk because you're just not steady on your feet. Lightheadedness, maybe visual disturbances, maybe some depression and some anxiety, some brain fog. How much do you feel the fact that brain fog is impacting your daily living when you are going out from the mall and you don't remember exactly where's my car, and I see all these people with like oranges on their antennas, and I feel like dropping my card off for these guys because I know they're dealing with some brain fog. Or not knowing where you put your keys every morning, or not knowing who you're calling in the middle of the phone call, and you don't see you don't remember who it is. These are brain fog. These are concerns because neurologically speaking, there's some inflammation in the body, and that inflammation is getting into the brain, and that's associated with, if we want to get you healthy and we want to get your back better, we want to clear up all these inflammatory cascade that's going on in your body. Headaches, low sex drive, loss of libido, digestive problems, IBS and Crohn's. You know, a lot of these things are what you're experiencing. So you're not digesting optimally, you're not absorbing your nutrients optimally. And how are you going to make a plant grow if you're not feeding it water? How are you going to make your body recover and your spine regenerate, or your discs to improve and get rehydrated if you're not getting enough oxygen or nutrients into your blood supply to be able to supply that? So that's an area where we really shine, and we can help you with that. So I always recommend that when I'm doing a workup on my patients that have neck and back pain, that they bring in their blood reports so that I can look at it from a functional scale, and we'll get into that in a second. Mood swings and many more, all due to the effects of spinal pain and the brain, and we'll talk a little bit about that right now. But before we get to that, let's talk about the common treatments. There's a medical approach, and the medical approach is typically a structural approach, where we are only addressing the spine from a structural point of view, and we're not talking about it from a metabolic point of view or a neurological point of view. Let's talk about some of the common treatments that are focusing just on the structural aspect of the body and not focusing on the metabolic and the neurological approach. The first one is physical therapy. Physical therapy can can be very, very beneficial, and is very, very beneficial for patients that have structural problems. However, I can't tell you how many times I'll have a patient that comes and sees me and they told me they went through 4 weeks, three times a week of physical therapy. It helped a little bit, but it didn't get rid of the entire problem, or it helped a little bit, but then the problem came back, or worse, it didn't even help at all. And so what does physical therapy include? It includes stretching, it includes exercise, it includes weight loss, it includes excellent modalities that we even do in our office, where you're trying to fix the core or strengthen the core, and those are all very, very good, but at the end of the day it still leaves you with a problem, and it doesn't address the metabolic and the neurological approach. Medication. Medication really isn't focusing on the structural aspect. All medication is doing is sort of like putting a band-aid over an oil light that goes on in your car, and the more you don't see it by covering it up, the more you don't think about it. However, medication isn't addressing the actual problem. Now, I can say that with a grain of salt, because if there is an inflammatory problem, let's say there's disc inflammation, or there's gastrointestinal inflammation, or there's an infection, then medication can go and reduce inflammation and can reduce the infection. So it does address some of the components, but we're talking structural. And so medication doesn't take the spine and get space achieved, or doesn't get rid of arthritis, or doesn't get rid of nerve pressure, or the actual wear and tear that's building up on the spine. Medication is sometimes needed. I hurt my back and I couldn't get out of bed, and I needed something to at least take the edge off so that I can function. So that can help you get by, but you know and I know that that is not a long-term solution, and it's not healthy for the liver, it's not healthy for the kidneys, and it's not even addressing the problem. And maybe what's happening is you're becoming dependent on it, and then you start having a drug dependency, which is a problem as well. Epidurals. Epidurals can be wonderful, wonderful things, especially if the pain, the structural problem that you have is radiating down the leg, into the foot, into the toes, into the fingers, into the arm. If you have a nerve problem that is radiating away from the spine, in fact, if you used to have a back problem and now it's only in the foot, or it's only in the calf, or it's only in the hand or the shoulder, and you don't remember it being in the neck anymore or in the lower back, then epidurals are probably going to do really, really good for you. They're going to reduce the inflammation of the nerve, and they're going to reduce the numbing or tingling that you're feeling in the foot. But again, it's a short-term solution. It's not addressing what's causing the compression to the nerve root, and it's not addressing the structural wear and tear that's built up in the spine. What happens after another set of epidurals? You go for more. And I can't tell you how many people I see that told me they've done an epidural 3 sets this year, 3 sets a half a year ago, 3 sets the 2 years before that. They usually do well with the first set they first ever had 5 years ago, but after that it didn't do any good whatsoever. And that's what will happen is basically you're injecting your body with a steroid which is trying to settle the inflammation, which metabolically speaking is addressing or fatiguing your adrenal glands. And we'll talk to you about that. And then what else is the other option is surgery. And surgery is usually the patients that I see, it's their last resort. They don't want to have surgery. Surgery has come a long way, so there's different types, like we'll do fusions or microdiscectomies, or they'll do other facet injections, or they may do a removal or a rotor-rooter type of procedure, but it's invasive and you're going under an anesthetic, and those carry their inherent risks. And what do we do after after one surgery? Typically a patient will get another surgery. And so this is the road that you don't want to go down, and you need to start to address the 2 other aspects in the metabolic protocol and the neurological protocol. And chiropractic as well. I was a chiropractor for 10 years, 12 years before I started to actually do some metabolic and neurological procedures. And I would get a lot of patients better, but some patients we wouldn't get better because they have so many other things that are going on with their body. And let's talk about that. So what are the facts about surgery and epidurals? Statistics show that 1 in 100 of low back surgeries are successful. So are you going to be the other 99 that aren't successful? And what are you going to define as success? I tell patients, if you're functioning, you can get up out of bed, you can focus and concentrate, and you're not a 10 out of 10 in pain, and your foot's not falling down when you walk, or you can't lift your toes, or there's so much atrophy in their feet, then potentially you're not even a surgical candidate. Surgery surgery is really for the worst of the worst that have neurological hard findings and can't function, are at a 10 out of 10 in pain on a daily basis, and their life is on a standstill. So more often than not, you'll go see a surgeon, and the surgeon is the hammer and you're the nail, and they're telling you, yep, you're a good candidate for surgery, and you go and do it, and then it fails because there's all these other things that are going wrong with your body. Most surgeries take place again within the next 1 to 5 years. The brain habituates to the stimuli so that the epidural works the first time, but then the brain gets used to it and then it doesn't work anymore. So that's a neurological link where the brain is just habituating. Like, so if we wear a watch, we don't even feel like it's on there anymore. But when we first put it on, we're always aware of it. So when it habituates, it means that we're aware, we're no longer aware of the effect of the stimuli. And so you're no longer aware that there's even an anti-inflammatory going in there to relieve the pressure off the nerve, and guess what? Third epidural in, you're not feeling any improvements. Chronic conditions of the spine. This is a side view of the spine, so there's a lot of narrowing and degenerative changes that happen. So I'm not saying there isn't structural problems in your spine and they need to be addressed, and there's some wonderful things that we do in the office to address those. I'm just saying that it's not the whole clinical picture. The clinical picture is that you have a lot more things going on with your body that you don't even realize besides the chronic neck and back pain. So potentially you have type 2 diabetes, or your blood sugar levels are elevated, or you're pre-diabetic, or maybe you're reactive hypoglycemic and you're not eating enough food throughout the whole day and your levels crash. Potentially you have insulin resistance. So insulin's job is to get sugar out of the bloodstream and get it into the cells. And if insulin isn't doing a good job, then you're not going to heal. You're not going to get the nutrients that you need. Potentially you have a thyroid problem. Potentially you have other pains or other widespread muscular or joint pain known as fibromyalgia. Potentially you have vertigo, you're not steady on your feet, or you have sciatica or chronic fatigue, you have no energy, you get up with very little energy, or you have a little bit of energy, and then by the middle of the day you crash, and at nighttime you hit the pillow and you just aren't falling asleep. You have insomnia. Maybe you have an autoimmune disorder or disease. Maybe you have gastrointestinal problems. Maybe you have a migraine, or you can't focus. These are other things that are going on with your body. Maybe you have some other metabolic disorders, like you don't produce enough oxygen or iron in your blood to mature red blood cells, or maybe you have a thyroid problem, or maybe you have an adrenal gland problem. If you're in chronic pain, I had a back problem myself, and it wasn't until I injured my back that I started to develop adrenal fatigue, and that was because my back injury was so stressful for my body that required so much inflammatory control that my adrenal glands could no longer keep up with the demand of the inflammation control in my body, that I just crashed. So I couldn't focus, I had memory and problems, I didn't have energy throughout the whole day, I woke up with little energy, and I had pain everywhere in my body. If that sounds like you, then we need to address your adrenal glands, and we need to help fix those, and we can do that naturally. It's not about just taking this pill or that pill. Maybe you have a food sensitivity. Have you ever thought that if you're eating dairy or gluten or soy, that it creates a problem that may be creating more inflammation in your body? I'll get a lot of patients that say, well, you know what, doc, I don't have any food sensitivities. I did an allergy test, and that's good, because when you do a skin fold test and you test your IgE cells, then it means you don't have an immediate allergy, which is great. However, it doesn't mean you don't have a food sensitivity or intolerance to a certain food, which still creates an antibody, although it's not a skin fold test, it's a blood test. So take your blood and we measure it against other antibodies that you may be eating, like foods that you may have developed, and then next thing you know, you have antibodies to these foods, and you have an intolerance or an immune reaction. So every time you eat soy or gluten or bread or carbs or pasta, you may not realize you're breaking out in a hive, or you're getting, shortness of breath, or you're having an allergic reaction, but you're having a sensitivity to that. It's creating gastrointestinal problems, it's creating brain fog, it's creating your sciatic pain that you're looking for a neck pain solution to. And so that is part of the clinical picture that we need to address, and we need to remove, and we need to clean up your gut so that we can help your neck and back pain. Hopefully a little bit of this is making some sense to you and you're like, yeah, why hasn't anyone ever told me about it? And that's the different approach that we take to try to get you not only out of pain and doing the things that you like to do, but get you healthy and get you focused and get you positive and feeling great and energetic. These are the things that you deserve in your life. And also chronic inflammation. So let's just talk about the metabolic approach. So we mentioned we have a three-pronged approach. We have a structural approach, which we'll talk about, that we're doing a lot of the things different that you're not getting anywhere else. We have a metabolic approach and a neurological approach. The metabolic approach, this is what we're going to talk about right now. Metabolically speaking, when you eat food and that food gets converted into energy, that's what we defined as your metabolism. And so the example I use is, think about an assembly line, and there's workers on the assembly line, and each worker has a job of putting a bolt in the project, or another one has to put a screw in it, or another person has to put a nut in it, whatever it may be. If one of those factory workers are missing, then that whole process isn't going to happen properly. And that's how energy is produced. So we need proper enzymes, we need proper thyroid hormone, we need proper oxygen and sugar levels, we need proper optimal mitochondrial function, we need reduced inflammation, we need antioxidants, we need a lot of things to happen. And if they're not happening, then you're not producing energy. And if you're not producing energy, you're not healing. And if you're not healing, you have neck and back pain. So you have a metabolic problem, and we need to figure out what is causing the metabolic problem. But more importantly, when we produce energy, so let's say we have those assembly line workers, and the finished product is energy, where do you think that energy goes? In our body. That energy goes to our nervous system, to our spinal cord, to our cells of our brain. And if those things aren't getting proper fuel, then you're going to have chronic pain, fatigue, energy, focus, concentration problems. So you need a good metabolism for a well-functioning brain, and you need a well-functioning brain for a good functioning spine, and vice versa. Put it another way, bad metabolism, you're not creating energy, is going to create fatiguing of your brain, which is a part of your brain is your cerebellum. When there's problems structurally in the spine, then you're getting bad information to the cerebellum. So not only is that cerebellum not getting the proper fuel because of metabolism problems, but because of a spinal problem, it's not getting proper stimulus. So now what happens is you have disc pain, and it's chronic, and no matter what you do structurally, that cerebellum isn't getting rehabilitated. So for permanent results, what we're looking for is areas of three areas to address is structural, the compression, neurologically, the brain and the cerebellum, and then metabolically, inflammation. And if you're focusing on all three of these things, then you could really get some long-standing relief. So let's start with the brain. So let's go into the neurological. When the brain isn't functioning optimally, then you're going to have a lot of these symptoms. So what is the approach to fix that? We do brain-based therapies in the office. So let's talk about cerebellar fatigue. If your cerebellum is fatiguing, you may not have good balance, or you may be experiencing vertigo. You may have chronic neck and back pain, and you may be clumsy. You may be bumping into things or dropping things. That's a cerebellar problem. Cerebellum also controls your eyes and your muscles of your spine. So a bad cerebellum equals a bad spine. A bad spine equals a bad cerebellum. And so what I typically do is I do an exam where I have you close your eyes and try to touch the tip of your nose. A lot of the times I'll see patients do this, or they'll miss. So you can just stand at home right now and try to touch the tip of your nose. And if you have a bad cerebellum, you're not going to be able to do that. Do it with your eyes closed. If you miss, call me and we'll work you up and help you with your cerebellum. Chemical, physical stress to the brain, so you could have a lot of things that are causing a bad cerebellum, and we need to address those. So that's where the metabolic comes into play. Anemia, maybe your red blood cells are too low functionally. You may have been told they're normal from a lab range, but they're not normal from a functional scale, which I'm going to explain to you in a second. Or maybe your hemoglobin is low. I see a lot of patients on a daily basis when I look at their blood work, and their hemoglobin is functionally low. They're not creating enough iron transportation and oxygen transportation to their body and to their brain, and their cerebellum fatigues. Or maybe you have a blood sugar imbalance. If your blood sugar is above 99 and below 124, you are insulin resistant and you're not getting enough sugar into the bloodstream, into the cells. And that's fatiguing. Or maybe you have food sensitivities. If you're sensitive to dairy, to gluten, to soy, to corn, that's going to create inflammation and that's going to affect your cerebellum. Or maybe you have an immune system problem. Your own immune system is attacking the cerebellum. That's a very common thing we see. Or maybe your immune system is attacking your joints. That's another common thing we see. Maybe you have a poor diet. You're eating too much omega-6s to omega-3s. That's an inflammatory diet. So maybe you're eating too much processed foods or hydrogenated vegetable oils. These are things that are going to create a lot of inflammation in your body. Or maybe your thyroid's not functioning optimally. Again, all of these things could affect your cerebellum. What about prescription drugs? I can't tell you how many times I see a patient come in and they already have their nicely laminated list of medications that they take, and there's probably 6 to 10 of those things. All of those can be causing side effects of lack of stimulation to your cerebellum. Hidden gut infections, that's huge. If you have some kind of gastrointestinal problem, chances are you have an infection. Bacterial, viral, parasitic, fungal, even heavy metal toxicities. Those can all cause problems, and we need to get you healthy. That's the bottom line. If you're watching this video and you have a neck and back problem, my approach is to try to help your body by getting healthy. That's what we do in the office. So how is brain-based therapy different? We provide the fuel and we provide the activation. So we're trying to get you to have some more oxygen in your blood supply, and we're trying to get some more sugar into the blood supply, not so much into the actual blood, but into the cells. And then we need to do exercises much like your brain is a muscle, like my bicep muscles are muscles, then I need to do brain-based exercises to help you with that. So what are some of the exercises we do in the office? We have a vibration machine that helps stimulate the brain and the cerebellum. We do unilateral adjustments to one side to help stimulate that cerebellum. We do some spin therapies very, very slowly. We do some movements where you're focusing on your arm to stimulate the cerebellum. We also do smells and sounds and vibrations and exercises for the eyes. Remember, the cerebellum innervates the eyes and the spine. So when we do decompression, we're actually doing cerebellar exercises to help get that fixed. Metabolic disorders that cause cerebellum problems, anemias, we talked about blood sugars, food sensitivities, immune system problems, adrenal gland problems, thyroid problems, hidden infections. So you could see that going on medication or going on through the chiropractor or going for physical therapy may be helpful, but it's not addressing any of these things. And that's what we do different. How do you know if you have any of those things? You have to do proper testing. And the majority of the time, insurance won't pay for these testings. And that's where I get into the video where I say, guess what? Insurance is like car insurance. If you get in a car accident, insurance will pay for that. If you have a transmission problem, or your oil is low, or your car is not working properly, insurance won't pay for that. Insurance pays for acute conditions. Get in, break a bone, have a infection, have a trauma, have a rupture, do something like that, and medicine will fix that. But have a chronic condition like a back problem where there's an anemia, there's a food sensitivity, there's an immune problem, there's a thyroid problem, there's an insulin problem, there's a hidden gut infection, there's food sensitivities. Not one pill is going to fix that. And so unfortunately, don't shoot the messenger, but what we find is that if you want quality care for your chronic condition, some of the office therapies that we do in the office are going to be covered, but a lot of the testing and nutritional supports that we do is not going to be tested. Do I want them to be not going to be covered? Do I want them to be covered? Absolutely. Is it covered in reality? Very, very seldom. In fact, I'm finding that insurance pays less and less nowadays, and as you know, it's a broken model. So how many of you have been told that your blood tests are normal even though you still feel terrible? That's what I wanted to talk to you about with the difference between laboratory ranges and functional ranges. So every patient that comes to get worked up for a spinal problem with me has to bring their blood work. In fact, any patient that gets worked up for their neck or back pain need to watch this video, because I don't want to waste my time in my consultation with you, explaining to you how I look at your body and how we try to fix the problem. I want to spend my time knowing about what's going on with you, with your blood work, with your lab results, with your questionnaire that you fill out for me, with your MRI reports, what you've done to get into the situation that you are, what you've done that hasn't helped. I want to spend time on you. I don't want to spend time on explaining, oh, this is what we do in the office. I want you to understand that before you get here, so that if it makes sense to you and a light bulb goes off and you think, yeah, that's what I need, then you're coming to see me. If it doesn't make sense to you and you're like, nope, I just want that magic wand, I want that structural care where you just take pressure off my spine and that's it, that's all, and I'll do an epidural, then this is not for you. And that's why I created this video. So I make it necessary for every one of you guys to watch this video before I see you, so that you know exactly what I do. I'm going to care 100% of what I do in trying to help you. However, what I'm not going to do is I'm not going to care more than helping you than you're going to care to help you. My office is in an emergency room, and so that doesn't mean I have to accept every single patient that comes into my office. If you're going to be a pain in the butt and you're not going to care and you think that this gluten thing is a ridiculous thing, it has nothing to do with what you're suffering with, or you being insulin resistant doesn't have anything to do, or you having a hidden gut infection, it doesn't have anything to do with what's going on, then you know what? We're not a good match. And I don't take it personal. But if you're coming in here and you're going to give me a hard time and it's not what you're looking for, then don't come in. If it makes sense, come on in. I want to help you. We got that out of the way. Let's talk about the functional ranges. So functional ranges are what's considered healthy. Lab ranges are what's considered broad. So I'll do a workshop, or I'll do a video, or I'll talk to a patient and they'll say, you know what, doc, my blood test is normal. I've been told that I'm as strong as an ox. And I say, perfect, bring in your blood test, and sure enough, it's normal. There's no L's, or there's no N's, there's no lows, or there's no highs, and there's nothing going on. However, then I put it on a functional scale. A functional scale is more narrow, and it was determined by the Endocrine Society on what's considered healthy. So you got to think, who are you being compared to when you have a lab range? You're being compared to all the people that took the test for that laboratory. That's why it's different in Houston than it is in Tulsa, than it is in New York, because there's different people that took the test that got averaged. But either way, you're going to be compared to the average of all the people that took the test for that lab in the prior year. So number one, do you think all those people are healthy? Not always. And number two, you're being compared to these people that aren't necessarily always healthy. So if you're not sicker than them and you are healthier than them or as healthy as them, you're told you're normal. That doesn't necessarily mean you're healthy. In fact, I can't tell you how many times I see a patient that says, yeah, the doctor said I was as strong as an ox. I said, well, how do you feel? They said, well, you know what, I don't feel as healthy as an ox. I feel like I'm tired, I have brain fog, I have sciatica, I have pain, I don't sleep, I have gastrointestinal. Well, how come your blood tests are normal then? So that's where a light bulb goes off, and that's where I require you to bring in your blood work so that I can put it on a functional scale. Some of the examples I use is glucose 85 to 99, 100 is an optimal range, 65 to 110. So there's a difference there. TSH 1.8 to 3.0 is a healthy range. 0.3 to 5.7 is the laboratory range. Cholesterol is one of the only ones that you'll typically see that the healthy ranges are broader. And that's like, well, what does that mean? It means usually on a lab test, the results for a laboratory cholesterol is less than 200. But from a functional scale, you could have it up to 220. And that's another video for another time. But cholesterol lowering medication, in my opinion, is the biggest myth and the biggest marketing scam that's going on out there. Not to say that some people don't need cholesterol lowering medication, but they need to focus on their inflammation in their body that's creating the cholesterol to deposit into their vessels. And so I kind of get a little bit, I guess, political when I hear people taking cholesterol and tell them that sometimes your cholesterol is actually too low, and that's a problem, versus too high and it being a problem. So we get sidetracked a little bit there, but I feel that cholesterol, 25 years ago, this big mandate to get cholesterol lowered, and let's get everyone on cholesterol lowering medication, and we'll see a decrease in the amount of people that suffer with cardiovascular diseases. Yet 25 years later, you have more people suffering from cardiovascular diseases than ever. And if it was a matter of just taking cholesterol lowering medication, wouldn't this go away? Or why is it in some Mediterranean societies you have people that have cholesterol levels above 300 and they don't have near the incidence of cardiac diseases or sclerosis or all these problems that we have in North America? It's because it's not a cholesterol problem per se. It's an inflammatory problem, and that's what I feel about that. Anyways, so based on your history, we may run some additional testing. I may find that your complete blood count is 90% of the time completely deficient in all the things that I want to see. I may not see your liver enzymes. I may not see their thyroid antibodies or thyroid markers. I may not see any inflammatory markers like homocysteine or uric acid. I may not see any lipid profiles. I can't tell you how many times I don't see cholesterol on those blood tests. I may not see even an auto differential. I may not see white blood. I may not see vitamin D. I need to see a complete blood count. I may suggest a salivary hormone test for adrenal glands and for hormonal function like progesterone, testosterone, estrogen. We need to see how those are balancing, because if you're taking hormone replacement therapy and you're not addressing these metabolic problems, you're going to see some of these pathways spill over into another side, and that's going to create inflammation as well. I can't tell you how many times I have a patient come in and tell me, I'm going to my anti-aging doctor and they got me on testosterone. I have a female who's doing that, and no one was managing her properly. Her liver enzymes were elevated. She had a lot of chronic fatigue and brain fog, and all they were doing was giving her testosterone just because she was supposedly deficient. We may do stool samples to check for parasites, and we may do food sensitivity testing. And guess what? Do these tests get paid for? Seldom they don't. And should you care? No, you shouldn't care. This is your health. You can chintz on certain things, like if you're staying on a boat and you want like the upper room versus the lower room, and you want to save a little bit of money, that's fine. Or you may go with a different plan with your AT&T carrier and not get as many minutes and save some money. That's fine. But when it comes to your health, and knowing what is responsible for your inflammation, and more importantly, your neck and back pain, and you want to know all the answers, should you care that insurance is not paying for it, and should you save money? Insurance should pay for it, don't get me wrong. Insurance doesn't pay for it, and you need these tests done. Now, that's not to say I won't work with you if you don't get them done, but just realize I'm not giving you my best recommendations because I don't have all the information. We can go on a removal diet and remove these foods and just assume guilty until proven otherwise, and then after 30, 60, 90 days, we reintroduce one food and see how it makes you feel. And if we have a reaction, then we know that that food was potentially the inflammatory stimuli that caused that problem. We could save money, but why not just get the test done? Also, we do, based on your lab findings, we may make some recommendations to help fix the gut, to help make the thyroid and the adrenal glands work properly, to help with liver and detoxification, to help with the anemic concerns, to help with balancing blood sugar, and more importantly, to help with your autoimmunity, if you are autoimmunity. In fact, my practice is so rampant with autoimmune patients. When I have them come in, even if they're coming in with a sciatica problem, and they bring me 20 pages of notes and the Santa Claus bag of supplements, my first reaction is this person is autoimmune until proven otherwise. Autoimmunities for spine could be psoriatic arthritis, could be Reiter's syndrome, could be rheumatoid arthritis, could be gout. A lot of those are autoimmune. Could also be lupus. So there's a lot of things that we need to figure out. Bottom line is that most patients that I have that come into my office that have sciatica problems are inflamed. Their back is inflamed, their gut is inflamed, their brain is inflamed, their joint is inflamed. Inflammation is like a blowtorch, me taking a blowtorch to this TV and then just having it not function. Inflammation in your body is like taking a blowtorch to all your joints, all your organs, all your tissues, and they're not functioning properly. Major causes of inflammation are insulin resistance, poor omega-3 to omega-6 ratio, food sensitivities, unhealthy gut bacteria, and hidden infections. How do you know if you have these things? We need to test them. Chronic spinal compression. So let's talk about the things that we do that are similar to some of the things that you may have been initially wanting to come in here, but now that I've shared so much other information on what we do, you're like, yeah, what do you actually do for the structural component? Treatment for damaged discs, herniated discs, neck and back pain, spinal stenosis, non-surgical spinal decompression. That's the DRX 9000 that we have in our office. It creates a vacuum-like force in those discs that help suck in the inflammation or fluid, or suck in the actual disc material, and it puts more fluid back into the disc, and that is going to allow that disc to heal. This is what the machine looks like. We have a decompression machine for the neck and for the back. And I'll tell you, I have a lot of patients that only do decompression. They don't want that stuff that you do with the food sensitivities or the gut, and they don't care if their sugar levels are 140, they're on metformin, or they're on insulin, and that's good enough. You know what? I got to tell you, you'll still probably get better with the decompression. So we do that. I don't recommend that, but if that's something you're looking to get out of our office, we work with patients in that capacity as well. I also do something called the HACOMed, which is the first office in Boca Raton to get this. It's a horizontal microcurrent. It's for patients that have neuropathy in their feet or in their hands, or they have sciatic-like pain, and this is going to help with the recovery of those nerves. We also do a laser. Laser is awesome for regenerating the cells and the metabolic processes of the body, and so we can do that in the spine, in the neck, in the wrists, wherever we may need to do it. We also do vibration therapy. That's going to help stimulate your cerebellum and do some brain-based exercises. So basically we do brain-based therapies, advanced structural approaches, we do the metabolic lab approaches, and we put all of those together. So my approach is non-surgical decompression, spinal adjustments if necessary. Obviously we'll use some heat and ice, some modalities that was going to help with the pain, ultrasound and electrical stim, cold laser, the HACOMed to try to regenerate the nerves, identifying the metabolic problems and reducing inflammation in your body. We also do advanced spinal exercises for cervical, and then of course we do brain-based exercises. So in my office, hopefully by now you're learning that we do a little things different. We approach it from a structural approach, we approach it from a neurological approach, and metabolically. I try to use the motto that I don't let any stone unturned to figure out what's going wrong with your body so that we can get you feeling better than you've ever felt. So what's next? What's next is you call my office and you schedule 2 appointments. The first appointment, we're going to have you fax in or bring in your blood work, fill out my metabolic assessment form, my brain functional assessment form, my neuro assessment form. These are forms that are going to give me an idea as to where some of the neurological and metabolic breakdowns are occurring. If you have an MRI, then bring in your MRI, and then bring in t-shirts and a shorts so that I can do a very, very thorough neurological exam on you and determine how much of the neurological impact is affecting your spine and, more importantly, the rest of your body and your brain. I always recommend that a spouse be with you, and that's because your spouse needs to see how serious your condition is. Your spouse needs to see this video. Your spouse needs to see that we don't just approach it from a structural approach. On day 2, you come on back with your spouse. I'm going to give you an overview of what I found from your MRI reports and whether or not you're a good candidate for the decompression or the brain-based therapies we do in the office. The decompression mainly has 3 reasons why you're not a good approach for that. We'll go over that. And more often than not, I don't see anyone that has that. And then I go over what we found from a metabolic point of view, what your blood tests are showing, what you filled out from a a assessment point of view, where we need to go, what kind of supplements we may be using. Don't get me wrong, I don't want to put you on supplements forever, but we need to fix some of these metabolic breakdowns that are occurring in your body and remove certain foods that are creating inflammation in your body, as well as the structural care, and so that we can get the results that we're looking for. And again, I suggest that you be with your spouse on that day too. What I want also to explain is bring t-shirts and shorts so that I can do a thorough exam. I want your paperwork completely filled out, and I want your spouse to be here. What my offer is I only accept 5 new chronic neck and back patients per month. I see a lot of other patients in my office, like neuropathy, IBS and Crohn's, thyroid disorders, even insomnia and ADD, ADHD, neurological disorders, Parkinson's we're starting to see now in our office. We have a recovery strategy that focuses on a lot of the metabolic and neurological problems that are going on with these patients too. And so I'm busy and I don't have time to see a lot of patients in all different areas. Typically my initial exam is $450 for 2 visits. I go over in depth what's going on with your blood work. I do a neurological exam that I pretty much guarantee you haven't had ever done before. In fact, if you feel your neurological exam is like you've had it done before, I'll give you your fee back. And that fee is $75 for 2 visits. And if I feel I can't help you, I'll also refund your money as well. 3 rules that I have: I don't want the pains in the butts. I don't want patients that are going to give me a tough time. I want you to ask me questions, and I want you to understand what's going on with your health, but I don't want to care more than you're going to care, and I don't want you to say that I'm not going to do that, or I'm not going to do this, or I'm not going to do that. You're at the wrong place. If this video doesn't make sense to you, and you're not shaking your head like, yeah, I got to do all that stuff, then maybe we're not for you. You have to take accountability of your health. Your insurance may pay a small portion of what we do. I accept Blue Cross and Blue Shields. Actually, up until April, I won't even be on Blue Cross and Blue Shields. So by the time you're watching this video, the only thing that I accept at this point in the game is Medicare. And Medicare will pay only a small portion of what we do. Then what I basically do is I create a care plan for you, and I explain to you how much it's going to cost. The cost can be anywhere, depending on how many therapies I need to see you. It could be somewhere, what I tell my patients is $100 a month to $300 a month, anywhere between 12 payments to 24 payments. So if you finance it over 24 payments, you may be looking at $100 per month or more. I don't know what you need. I'm just giving you a ballpark and let you know that when it comes to day 2, when you have your spouse with you, and I've gone over all the things that I find is going wrong with your body and all the suggestions that I'm going to make, then you're either going to tell me yes or no. Hopefully you're going to tell me yes. But what you're not going to tell me is I need to go home and think about it. And because most of the time when I have someone tell me they need to go home and think about it, I feel I haven't provided you with enough information. That's why I'm presenting this video. So this video is a necessary requirement for you to come and see me. If you haven't watched this video, I'm not going to see you. If you've watched this video, then you know the ballpark of how much this is going to cost you, and it's a matter of saying, yes, I want to do it, or no, I don't want to do it. And I have no hard feelings. I'm a very busy guy. I want to help you, but I don't want to waste your time, and I don't want you to waste my time. Think about how serious this problem is. Are you not enjoying your life? Are you not going out to the places that you want to go? Are you not living the life on your terms? Are you in pain at all times? Do you have energy problems? Are you just not feeling the way you should at this point of the game? If you're not, and you don't want to do anything about it, then I can't help you. If you're not feeling the way you want to feel and you want to do something about it, or more importantly, you want to do something about it for you and for your loved ones and to enjoy your life, then give me a call, I urge you. But make sure that you're at least an 8 out of 10 in how badly you want to get better, because if I care more than you, it's not going to work out. I hope you found this video very, very informative. My office number is 561-883-0090. Give my office a call and tell them you're ready to do your 2-visit structural, neurological, and metabolic assessment for your neck and back pain, and I hope to see you soon. My name is Dr. Joel Rosen, and thank you for watching this video. Thank you so much.